because I left it upstairs, and I'll be right back.
Okay.
Okay.
Wonderful.
Thank you.
Thank you. Thank you all for showing up here today and welcome. My name is Bethany Sullivan. I have my own agency called Sullivan Healthcare Solutions. I specialize in Medicare. It's the only thing that I do. That was a very intentional decision. I don't sell or market Obamacare or anything else. The reason that was intentional is because Medicare is very complex, which is probably why you're all here. And it's complex for not only the consumer, but it's very complex for the broker. And it's a lot to keep up on. It was intentional because I wanted to become a subject matter expert in this space. So a little bit about myself. I'm an independent licensed broker. I specialize, like I said, in Medicare products. I'm certified with multiple insurance carriers. I have very high standards on who I decide to contract with and why. I'll get into that a little bit more in the presentation. I market Medicare supplement plans, which are also called Medigap plans, Medicare Advantage Part D plans, Medicare Part D plans, which are your medication plans, and then a separate group of plans. They're called dual eligible special needs plans. Now, these plans are designed for the dual eligible population, which is basically the Medicaid population and the Medicare population. It tends to be special needs individuals, either with cognitive needs or physical disabilities, somebody that goes on to Medicare before age 65 at any age, and they have Medicare and Medicaid, they would qualify for that type of plan, and they are government funded plans. I have a 20-year history working in the health benefits field. I started right out of college with a law firm. I learned the legal end of things, was trained that way. I went into the corporate world, worked for some large companies like Fiserv and Quad-Graphics. I then branched out into the Medicare space because I really saw a need to help people, and it was more kind of in that HR role. I put my emphasis in my business is education, and I'm very customer first. I'm also unbiased in my approach. So my goal when I sit down with people is really to explain Medicare Part A and Part B, which is original Medicare, the rules, the costs, the premiums, the deductibles, what it doesn't cover. Then I'll talk about the different types of plans, the Medigap, the Medicare Advantage plans, the rules around those, both at the time that you come in and then going forward because the rules change. I market in Wisconsin, Florida, Indiana, Minnesota, and Virginia. So I'm gonna just start by just asking for just a raise of hands for anybody in the room that currently is on Medicare. Okay, so like about 50% of the room. And then for the group that isn't on Medicare, any experience maybe with helping a parent or an aunt or someone like that, any knowledge? Okay, I just wanted to get a sense for that. So our agenda for today, Medicare overview, how do you qualify? Parts of Medicare and costs, when can I enroll? How do I enroll? And then some special rules about health savings accounts. So who qualifies for Medicare? So you have to be a US citizen or a legal resident, age 65 or older. People under age 65 qualify, as I mentioned before, if they have a qualified disability. Basically what you do is you apply for your Social Security disability. You're in a waiting period for 25 months. 24 months. On the first day of the 25th month, you come on to Medicare. You also qualify immediately if you have an ALS diagnosis or end-stage renal disease. So a little bit about the history of Medicare. Medicare in terms of the budget, now these numbers are a couple of years old, but huge part of our federal budget, 12%, began in 1966 during the Johnson administration. Originally, all that existed in 1966 was Medicare A and B. None of these other plans existed. They then established disability coverage in 1972. In 2003, they added the Medicare Advantage plans, and the Part D plans were added in 2006. So Medicare has coverage regardless of pre-existing conditions and regardless of income. It also currently covers over 65 million people are currently on Medicare. So essentially there's 4 parts of Medicare. Medicare Part A and Part B are your governmental part, also called Original Medicare. Medicare Part C, those are the Medicare Advantage Part D plans. Medicare Part D are your prescription drug plans for your chronic health conditions. So your medications that you're taking daily might include eye drops or inhalers, that sort of thing. There are also Medicare supplement plans. There is not a letter for the Medicare supplement plans. I don't know why. I've always found that kind of interesting. So in terms of your premium for your Medicare Part A, which is your hospital umbrella of Medicare, as long as you have paid in your Medicare taxes during your working lifetime, which is 10 years or 40 quarters, your premium is going to be $0. The maximum premium that you can incur for Part A is $505. Now that's obviously for someone that hasn't met the 40 quarters or 10 years. Coverage includes inpatient care in a hospital, skilled nursing facility care, nursing home care that is non-custodial in nature, and hospice care and home health services if homebound. Now, one important thing to understand here is if any of you have long-term care insurance, Medicare does not cover long-term care insurance. So that's a very important thing to understand. If you feel that you might need to protect yourself from a long-term care standpoint, I would talk to your financial advisor about that, but does not include long-term care. So your out-of-pocket costs for Medicare Part A. Medicare Part A has a deductible. Now, all of these numbers are 2024 numbers. They are indexed every year by the federal government. They will be announced soon. We're kind of all waiting for those numbers to be announced. But in 2024, the deductible is $1,632. So this is for an inpatient hospitalization. You go inpatient, you're going to pay that $1,632 deductible. Now that deductible is not like what we're used to on group health insurance, where we pay it once during the calendar year, we go into a co-insurance situation. This is on a 60-day benefit period. So essentially how that works is the day that I'm hospitalized, let's say I'm hospitalized on January 5th, the first day of that 60-day period begins on January 5th. And 60 days from January 5th, if I'm hospitalized multiple times for the same or a different condition, I'm gonna not have to pay the $1,632. Once I'm outside that window, that 60-day benefit period, the benefit period starts all over and I'll incur another $1,632 deductible. So in a calendar year, if my health dictates that I have to be hospitalized multiple times and my timing is just perfect, I could be subject to that deductible 5 times. So there's a lot of risk there in terms of cost. And these are the reasons that you purchase a Medigap or a Medicare Advantage plan to help protect you against these things that we're talking about. Once you're hospitalized, the first 60 days is covered by Medicare. Days 61 through 90, you're going to pay $408 per day in co-insurance. Days 91 and above, you have what are called 60 lifetime reserve days. So during your lifetime, you've got an additional 60 days and you will pay $816 in co-insurance during those 60 days. Skilled nursing facility care also falls under Medicare Part A. Days 0 through 20, Medicare pays the coinsurance. Days 21 through 100, you'll pay $204 per day. So Medicare Part B. So Medicare Part B is kind of your medical umbrella. There's lots of different things that fall under the Part B. Your outpatient surgeries, your doctor's office visits, specialist visits, lab work, imaging, CT scans, MRIs, x-rays, what else? Physical therapy, occupational therapy, speech therapy, and the list goes on and on. I've actually provided a link. That's a URL link. So if Cheryl, Cheryl?
Yeah, just a quick question. Do you want to address questions at the time, or do you want to wait?
Why don't we wait until the end? Yeah, okay. So this is a URL link. So when Cheryl makes this available to everyone, this is going to link you to the federal website, and there's going to be a whole list of Medicare Part B covered services there. Medicare Part B does not include services for hearing aids or dentures or dental work or eye exams. So Medicare Part B has a premium, and when you first come into Medicare, when you elect Medicare Part B, you're going to pay in 2024 $174.70 per person. So as a married couple, you'll both pay the $174.70. Now that premium is subject to a federal law. It's called the Income Related Monthly Adjustment Amounts. Essentially what it is it's a high income surcharge. The federal government says, well, if you're married and you have a modified adjusted gross income of more than $206,000, or you're single and you have a modified adjusted gross income of more than $103,000, then they hit you up with additional amount that you're going to have to pay in addition to the $174.70. And this chart shows you, so it's indexed, as you can see. It starts at 103,000 and 206,000 and is indexed up to between 500, $500,000 and 750,000. And so the income related monthly adjustment amount is in that third column, and then the fourth column is showing your total premium. Now, what the federal government does is the year that you come into Medicare, so let's say I come in, I turned 65 in December of 1959, or December of 24, I was born in 1959. I sign up, I get a letter from Medicare, and that letter is going to indicate I owe $174.70 or I owe another amount. And if you owe another amount, you know you've been hit up with the IRMA surcharge. The way that this works is the federal government does not look at your current tax return, which, excuse me, can become a problem, because what they do is they go 2 tax years prior to the year, prior to 2024, they're looking at your 2022 tax return. Whatever your modified adjusted gross income was on that tax return is what applies for your IRMA surcharge. Now, that can be problematic for people who maybe 2 years ago you were working and maybe your income was a lot higher and now it's lower. So you have an ability to fill out a form. It's called an SSA 44 form. It's basically a tax document. It's a change of event form. It basically says to the federal government, hey, I got this IRMA surcharge and my modified adjusted gross income is X amount according to my recent tax return. And as long as you can qualify for the change of event, and some of the change of events are things like reduction of hours or I've retired, things like that. As long as you qualify and you fill out that form, you can get an adjustment essentially to that IRMA amount. The annual Part B, so Medicare Part B has a annual deductible, so it's not at a 60-day window. It's $204 per person in 2024. So once you pay that deductible, you go into a co-insurance situation. Medicare pays 80% of Medicare approved charges. You pay 20% of the Medicare approved charges. Important takeaway here is that there is no limit on that 20%. So if something catastrophic, let's say I have a stroke, I'm hospitalized, I can't walk, I have to relearn to talk, I come home, but then maybe I go to skilled nursing, then I come home and I have a lot of needs at home. Just know that the 20%, there is no limit on that. So there's risk there as well. So we went over that. Okay, so this slide is just showing you kind of two paths that you take when you first come on to Medicare. So you can either choose, so when you come on to Medicare, you're required to pick up Medicare A and B. Everyone has to do that. And you can either choose a Medicare Advantage plan, and the Medicare Advantage plans have the Part D component built into it. So it's kind of like a bundle. The administrator that administers the medical component of the plan has the umbrella for the medical, and then they have an umbrella for the Part D. If you go on the left side represents maybe somebody who has Medicare A and B, and then they elect a Medicare supplement plan. And the Medicare supplement plans do not have the Part D component. So if you choose a Medicare supplement plan, you're required to also choose a Medicare Part D plan. Okay, so Medicare Advantage versus Medicare supplement. So I want to just kind of go through the differences, and this kind of speaks to the models of the plans and how they're designed. So we're going to start on the left side with the Medicare Advantage plans. These are managed care networks. They are set up as PPOs, HMOs. We're all used to that. Most employers for the last 25 or 30 years have had managed care plans. You have to stay within the networks, or you have no coverage. The Medicare Advantage plans usually include the Part D medication benefit. The benefits under these Medicare Advantage plans can change each year, and they do, including the contractual agreements with your doctors. So it's important with these plans to pay attention to, it's called an annual notice of change. Every fall, every person that's on a Medicare Advantage plan gets an ANOC, annual notice of change. In that legal document, it'll explain all the changes to that particular Advantage plan. These plans in the state of Wisconsin and in other states as well, they have low premiums. So here in Waukesha County, most of the Medicare Advantage plans on average are about $25 a month in premium. But the real costs for these plans is what's called your maximum out-of-pocket amount. So the federal government has a defined amount that they tell the plan administrators what they can charge for a maximum out-of-pocket amount. In 2024, it's between $5,000 and about $12,000. So that's the maximum amount that an Advantage plan can charge in copays, deductibles, and co-insurance under their plans. So that essentially is what your cost is. Now, none of us know what those costs are. Versus on the supplement side, we'll get to your costs are more known on the supplement side. But your true costs on the Advantage side are the maximum out-of-pocket. So essentially, the way that these plans work is they have a benefit book, and any and all services under the plan are going to have a line item in the benefit book. I could look up MRI and I could see, oh, if I have an MRI, I'm going to pay $300. And that $300 is going to be applied towards that maximum out of pocket. Another way that I have to explain this is that The costs under original Medicare, the hospital costs, the 1632 deductible, what these carriers do is they'll take that deductible and they'll say, okay, we're going to pay some of that deductible and we're going to push that the other part onto the consumer. So with the hospitalization, what they might do is they might design it to say, okay, the first 3 days that I'm in the hospital, I owe $200 per day. And then days 4 through infinity, the insurance carrier pays the rest. So any hospitalization of more than 3 days, my cost is going to be $600. So essentially they're taking that 1632 and they're making the consumer share in the cost of that. Is how it works. Let's see. So I can't stress enough that these plans do change annually. So if this product is a product that you're interested in, you need to keep up with the changes. You need to, at a minimum, if you don't want to change products and get onto another Advantage plan during the Medicare open enrollment period, at a minimum, you need to make sure that your doctor that was contracted when you purchased the policy is still going to be contracted during the next year. And that's a phone call to the insurance carrier, and they'll look at the network and they'll be able to tell you essentially. So the Medicare Advantage plans are subject to the Medicare open enrollment rules. Medicare has a open enrollment, all 65 million people rush during the fall, October 15th to December 7th, to change the plans. All the commercials that you see on TV, they all have to do with the Advantage plans and the Part D plans. They are not talking about the supplement plans because the supplement plans are not subject to the Medicare open enrollment rules. So you cannot change the Advantage plans. You can change once a year during the fall, and your change becomes effective January 1st. The supplement plans, if you want to move from one supplement to another, you can do that anytime during the year. You call your broker, you tell your broker you want to shop for a different plan. You shop for that different plan. You have to go through medical underwriting to get from one plan to another. When you first come into Medicare, you have what are called guaranteed issue rights to both these products. They cannot look at your health history. They cannot look at anything pre-existing. They can't look at your meds. They cannot tell you no. But that all changes once you're on these plans, and it changes for the Medicare supplement plan. So you have a one-time shot at the supplement with no underwriting, and then going forward, you will be underwritten. The Advantage plans, there's never underwriting. Let's see. Okay, so the Medicare supplement plans, also offered by private insurance carriers. They are designed to supplement Medicare A and B. They follow federal and state laws, which are designed to protect seniors. They cover the gaps in original Medicare. There are 10 modernized plans throughout the country. Wisconsin, Minnesota, and Massachusetts has a very different system than the rest of the country. And honestly, the insurance commissioners in the state of Wisconsin were brilliant when they designed this for Wisconsin, because it makes shopping for a supplement plan way easier for people in Wisconsin. If you talk to somebody, if you have a relative down in Illinois, Illinois has a modernized plan. You might have your relative tell you, you really want Medicare Supplement Plan F. That's the one you want to purchase. Here in Wisconsin, there is no Medicare Plan F. So that's a little unique. There are no networks of doctors in the Medicare supplement plans. So as long as the facility accepts Medicare, they are going to accept your supplement. It does not matter what carrier you're with. So it makes these plans very portable, although the Advantage plans are portable because they have contracts of doctors out of state. You do have to go online. You do have to make sure that the doctor, hospital that you're seeing is covered in within that PPO. So the last bullet is that the supplement plans don't include the Part D benefit, which I touched on before. You're required to purchase a standalone Part D plan. And the federal government says, even if you don't have any medications, you're still required to purchase a Part D plan. So there are some crazy rules, unfortunately, like that. And you'll be penalized. And it's a penalty that you'll incur. It's not just a one-time penalty. It follows you the rest of your life if you don't timely enroll in the Part D plans. So I'm gonna explain one more thing. When you first come into Medicare, if you choose a Medicare Advantage plan and you decide within the first year you're on that Advantage plan, oh, I made a mistake, I want to move to a supplement plan, there is a look back period. It's a special rule that allows you to move to a supplement plan within the first year, no medical underwriting. But then once that year is up, then you have to go through underwriting. So that's kind of a unique rule. Okay, so this chart basically represents all of the other states, not Wisconsin, Massachusetts, or Minnesota, that has all these plans that I was mentioning. So I'm really not going to go into any detail. I do market in some states, Virginia, and a couple of the other states that I market in has this system. So I'm versed on it. I can certainly talk about it, but just because we're in Wisconsin, I'm gonna just skip this. So the Medicare supplement plan here in Wisconsin, the basic plan has what are called state mandates. So these are benefits regardless of carrier. Every carrier has to have these state mandated benefits. So these benefits are skilled nursing facility coinsurance, 175 days of inpatient mental health coverage, 40 home health care visits, as well as visits in addition to those paid for by Medicare. Beyond that, this slide covers the riders. So here in Wisconsin, there are 5 riders that you can add to the Medicare supplement plans. They are all voluntary. I will tell you that I've never seen anyone other than the foreign travel rider not add these riders, because if you don't add these riders, you expose yourself to the risks of the costs under Medicare A and B. So the first rider is called the Part A deductible rider. This rider picks up that full $1,632 deductible, up to 5 times, up to the maximum number of times that you can be hit with it. The Part B deductible rider is, so it picks up that $240 of Part B. This deductible is, or this rider is only available to people who turned 65 prior to January 1st, 2020. So there was a federal law. I don't want to get too much in the weeds. Doesn't really make complete sense to me, but there was a federal law back in about 2018 that said if you're turning 65 before 1/1/2020, you can pick up the Part B deductible. Anybody who ages in after that doesn't. And it essentially, from a cost standpoint, it becomes kind of a wash. And I've actually looked at the premium for this, because the premium cost to the insurer costs about $240, which is the deductible. So if you qualified for the Part B deductible due to your age, then the insurance carrier pays the deductible on your behalf through your premium. If you don't qualify, then you pay it directly to the provider. Either way, you're paying it. So I just want to explain that, because there are people, I think you'd have to be about 70 in order to potentially still be able to elect this Part B deductible rider. The Part B, Medicare Part B excess charges. So these come into play when a doctor does not accept Medicare assignment. Those providers can charge Medicare, can charge excess charges, which essentially are 15% above the contractual amount, what Medicare allows a provider to charge. So that doctor, hospital, whatever, inflates it by 15%, pushes that cost out to the consumer. By adding this rider to the policy, you are protecting yourself against the 15% excess charges. The fourth rider is called the home health care rider. So as I mentioned before, the Wisconsin base plan has 40 home health care visits in it. By adding the home health care rider to the policy, you increase your visits from 40 to 365. And then the last rider is called the foreign travel rider. This, it's important to understand under original Medicare that if you leave the country, you have no healthcare coverage. So it's crucial if you are going anywhere other outside of the United States to have travel insurance. And it's not something I market, but I think a lot of travel providers market it. I sit in rooms of brokers and I hear horror stories of people that are in Mexico that have no travel insurance and they're paying $110,000 on a private jet to get back to the United States. So really important if you're spending the money on the travel to spend the money on the travel insurance. The foreign travel policy is really just designed as more of an urgent care benefit. And the reason I say it's more urgent care is because the lifetime maximum is $50,000, not a lot of money. It will cover you in the first 60 days of a trip after a deductible, $250 deductible, and the insurance carrier pays 80% and you pay 20% up to that $50,000. The final rider, and I don't think I've ever had a client elect this rider, but it is an option. It's called the Part B copayment or coinsurance rider. It is a way of getting your premium costs down on your Medicare supplement plan, because when you elect this rider, you essentially agree to pay the lesser of $20 per office visit, or for an emergency room visit, the lesser of $50, or the Part B coinsurance. So for somebody that maybe is super cost conscious and they want to get their premium down, this is a way of potentially getting the premium down, but they are also putting more costs on them for some of these services. But it is an option. I have not had anybody select it. So like I said earlier, these are all voluntary. You do not have to add them from a practice standpoint. The only one that I see people not adding is the foreign travel rider. And I'll start by saying, if you're not planning on traveling, then, you know, why have it? I have some people that add it, and then when they stop traveling, they drop it. It's about between $1.50 and $1.75 per person per depending upon the insurance carrier, somewhere between that per month, $1.50 per month. So it's very affordable. So I have a lot of people taking that. Okay, so with the Medicare supplement plans, you have an open enrollment period, and this open enrollment period goes back to that term I used earlier, guaranteed issue. So you have a legal right to these plans. That legal right spans 6 months, beginning at your 65th birthday, first day of the month, and enrolled in Part B. And if you enroll during this time period, there are no health questions asked. Pre-existing conditions do not apply either. You also, for the under 65 group, and this is the disabled group, the under 65 group, it's a state by state thing. So some states allow people who are Social Security disabled to come on to the Medicare supplement plan. Some don't. Wisconsin is a state that allows for people to come on. So that's a great thing here in Wisconsin. Okay, so Medicare Part D. So as I mentioned earlier, you have to have a Part D plan. There's a couple of different ways of getting a Part D plan. You can get, the middle column would represent a standalone plan. That would be if you elected a Medicare supplement plan. The far right side would be if you're purchasing it through your Medicare Advantage Part D plan. And the left side is also a unique thing here in Wisconsin. So this, it's called Senior Care of Wisconsin. It's a state pharmaceutical assistance program. Essentially what it is it's a social services program that is designed for low-income Wisconsinites. So people that are 150% to 300% of federal poverty limit qualify for this, and the state of Wisconsin basically picks up their prescription costs. But there is a loophole in Senior Care of Wisconsin, and that loophole is that if you don't qualify based on your income, then you can still enroll. You can send in an application. I think the last I heard, it's, don't quote me because I haven't had anybody sign up recently. Somewhere between 30 a year and 60 a year in costs to, do you know? Are you on 35 a year? Okay, thank you. You pay 30, okay. So by electing Senior Care of Wisconsin, you are in a sense self-insuring your medication. So they are not an insurance carrier. If you don't qualify based on that low income, you are self-insuring. So if you need a medication, you're going to have to pay out of pocket for it. Why do people do this? Because they want to avoid the costs that are involved in getting a Part D plan, and Senior Care meets that federal rule of it's deemed to be a creditable plan. And in the Medicare world, creditable simply means legally it's as good as or better than a Medicare plan, and it basically staves off the penalty. So it's a nice option for people. I have people that are on meds and they elect it. They might be on low cost meds like lisinopril or statins that cost very little, and they don't want to pay, $10 a month for what it costs to shop for a Part D plan. So this is a nice option in Wisconsin. The other nice thing about Senior Care is that it gives you it's called a special enrollment period. And what that is it's a legal period mid-year, allows you to get into an insured plan. So let's say I elect Senior Care on January 1st, I send in my $35. I go to my doctor in March, I'm diagnosed with a condition that requires me to be on a medication that costs $500 per month. And I no longer want to self-insure that. I have a legal period, because I'm on Senior Care, to go to a broker and say mid-year, hey, I want to shop for a standalone Part D plan, essentially. So that's a unique thing, and that's actually a really great thing, because otherwise the normal rule is you'd have to wait until the open enrollment period in the fall, and then you wouldn't get onto the plan until January 1st. Okay. So we covered the first bullet. The Medicare Part D plans are very unique. What the plans that I recommend for people are essentially based on the meds that they're on. I have sometimes people come to me, couples that say, well, we both want to be on the same plan, and it doesn't work that way. It's really not to your advantage most of the time to be on the same plan. So what I do is I collect your medication information. I will collect, just exactly how many tablets you take, or if you're on an inhaler or whatever it is. I put it through a program, and it then tells me all of the Part D plans that are available to you in your county. And then I shop the most competitive for you. So we look at the copay costs, we look at the premium costs. It was very specific. This is a very competitive space. And I tell people every open enrollment period in the fall, shop these plans, because in the past, if you don't shop them, the plan that you're currently on about 90% of the time is not going to be your best plan. And you're going to leave money on the table simply by not switching to another plan. So the IRMA surcharge, that sneaky surcharge, unfortunately applies across the board. So if you qualify for IRMA based on your modified adjusted gross income and you're hit up with it for Part B, you will also be hit with it with the Part D. And so this chart again is going to show starting at 103,000 for single or 206, you're going to pay an additional $12.90 per month in premium. Okay, so this next chart is the model that governs the Part D costs. It's very complicated. I'm gonna explain the phases and a little bit about how it works. It's about to all be revamped in 2025 due to a huge piece of legislation that is going to change these numbers for everybody. They're expecting that it's going to be the largest shopping period for people this fall, basically due to the Inflation Reduction Act. So we'll go through the 2024 stages. So the first stage is called the deductibles phase. The plans are allowed to charge up to $545 in deductibles, most do. You have to satisfy that deductible before you go on to the second phase. The next phase is called the initial coverage phase, and you're in the initial coverage phase from $546 to a total cost of $5,030. While you're in that stage, you're responsible for 25% of the copay of your medication, and the plan pays 75%. Once you are at $5,031, you move into the donut hole, the coverage gap phase. You may have heard that term. While you're in that phase, you pay 25%. The plan pays 75%. People that make it into that stage it tends to be the most expensive stage for people. And it's really been very difficult for people who are on very expensive medications, because $8,000 to pay out of pocket in a year is a lot of money. If you make it out of the coverage gap phase due to your total cost, and that would be $8,001, you go into the catastrophic phase. During the catastrophic phase, the plan pays 20%. The government or Medicare pays 80% during this phase. Your costs tend to be the least in that phase for people that have these very expensive medications. Now, all of this is being revamped. There was a piece of legislation that was passed a couple of years ago called the Inflation Reduction Act. They have slowly made changes each year, I think starting in 2022 or 2023 to this model. But 2025, they're expecting are the largest changes. So the left side of the screen, the bar chart is essentially what we just covered. It's the 2024 model. The right side is the new model for 2025. And essentially what the government is doing is they're getting rid of the donut hole. There are only going to be 3 stages. They're going to have the deductible phase, the initial coverage phase, and the catastrophic coverage phase. As I said, the donut hole is going to be eliminated. The initial deductible is increasing from $545 to $590 in 2025. The other very large change is they are capping the out-of-pocket spending amount to $2,000. So once you hit that 2,000, you don't pay anything more. And if you look at the 2025 chart, one of the concerns that brokers and people in this field have is that if you look at 2024 in the catastrophic range, Medicare, the green box, was paying 80% in that last catastrophic phase. In the catastrophic phase in 2025, Medicare is only going to be paying 20%. So who's going to pick up the rest? And that becomes the question. You know, consumers likely, the insurance carriers are going to pass those costs on to the consumer. And unfortunately, none of the data on these plans is even available to you as consumers, me as a broker. Nobody has this data yet. It's not going to be released to October 1st, but people are speculating based on the webinars and educational things that I'm doing that the people that have paid very little, like because they're on low-cost drugs, are going to absorb the costs of the people who have been paying a lot. And it is going to be incredibly important to have, if you're in a Medicare Advantage plan or on a Medicare Part D plan, to have that cost during the open enrollment period because of these changes. Other than what I have here to communicate, I don't know individually how it's going to impact really anyone. And it's all specific to the medications and all that people are on. So this is really big. The other change, and this is a good thing, they are starting, it's called a Medicare Prescription Payment Plan. They're referring to it as M3P. It allows for people, instead of having to pay, let's say for somebody that has maxed out their $2,000 in medications, it allows them to take that $2,000 and spread that over a 12-month period. So in this case, pay $167 per month instead of have like a couple of months of $800 a month or 200, $800 and $200. So it essentially is allowing them to do that. We don't know exactly how this is going to work. I think it's going to fall on the pharmacies, but I don't know. There's a lot of talk that it's going to put some pressure on the pharmacies in terms of how they're going to work this out. So again, the key takeaway is shop. Make sure you shop this year. Otherwise, you're going to have huge surprise in January. Mm-hmm.
Just a real quick question. So it's going to change. The D is going to change. Is the expectation that the premiums are going to be jacked up to cover that?
Yes.
Like quite a bit, because now the average price is what, $25, $30 a month?
The average price of a Medicare Part D plan is, I think, about $36 a month. But
Okay.
yes, there's talk that the premiums will go up. Mm-hmm.
No projections. Is that to come out in October?
October 1st. Open enrollment starts October 15th. Brokers can start to talk to consumers about the plan legally on October 1st. But I don't even have access to the data at this point. All I have, and I will not have access until October 1st. But what I'm doing at this point for all my clients is I'm collecting all of their medication stuff. I send out a newsletter, which you all got. And so what I'm doing is having people fill out an intake form if they want a quote. And then I'm doing that now because it's gonna be crazy this fall for lots of people, for brokers. Okay, so when to enroll in Medicare? So you have what's called an initial enrollment period, 3 months before your 65th birthday and a month of your 65th birthday, 3 months after. If you enroll prior to your 65th birthday, your enrollment starts the first day of the month in which you turn 65. So if I turn 65 December 10th, my enrollment starts December 1st. If I have a first of the month birthday, December 1st, my Medicare starts November 1st. It goes to the month prior. If I enroll in the 3 months after my 65th birthday, let's say I enroll in the 4th month, then my Medicare plan starts the first day of the 5th month, is how it works. Okay, so who receives Medicare automatically, Medicare A and B, versus who needs to apply for Medicare A and B? So if you are someone who is electing Social Security prior to age 65, so let's say you start pulling your Social Security at 63, then Medicare, the federal government, automatically signs you up for Medicare A and B. It is an automatic process. It unfortunately causes problems for people that don't want it. If you're one of those people that gets that card, you can turn it over, sign the back and say, I don't want it, and mail it back to the federal government. But unfortunately, it's just part of the process and it does cause issues. People who are disabled, like I said earlier, if you apply for a Social Security disability, you have to be, you're in a 24-month waiting period, first day of the 25th month, you then automatically go on to Medicare, and you have a open enrollment period, if you will, for a Medicare supplement plan with no underwriting. So this becomes important for, let's say, a 30-year-old qualifies. So they're going to have guaranteed issue rights when they become disabled at age 30. They have that window, that 6-month window. But if they don't elect a plan in that 6-month window, then they're going to either have to go into an advantage plan. The other thing that happens with those groups is they have a legal right, a second right to open enrollment guaranteed issue when they turn 65. So they basically have 2 guaranteed issue periods. Who needs to apply? So basically anyone else, anyone not electing Social Security has to physically apply. Oh, I think I skipped the screen, sorry. Okay, and I think I skipped a bullet. So anybody diagnosed with ALS will receive A and B the month the disability benefit begins. Okay, this is a big question. Lots of people call me all the time. Can I delay Medicare A and B? You can under some circumstances. And those circumstances are you are actively employed or your spouse is actively employed and they are working for a company that offers group health insurance, and that company employs more than 20 people. And as long as that criteria is met, you can stay on that group health insurance and you have a legal right to stay on it. And then when that group health insurance ends, you then have an 8-month enrollment period. It's a guaranteed issue, can't look at your health. Basically, it's called a special enrollment period that you qualify for. There's a special COBRA rule. You are required to end COBRA. You cannot COBRA after 65. You are required to get on Medicare A and B. That's a big one to understand, because if you COBRA and then you at a later date try to jump onto Medicare, you're going to face fines. And so that can be problematic. There's some special rules for the military. I don't come across a lot of military, and I'd love to help more veterans. So I always have to kind of look at this a little more closely. So if you have TRICARE and you are retired, you are required to enroll in Medicare Part B in order to keep that TRICARE benefit. And TRICARE is like the gold standard for vets that have the service, that sort of thing. Not everybody has TRICARE. If you or your spouse are on active duty, you don't enroll in Part B. You don't have to enroll in Part B to keep TRICARE while on active duty. But before retiring from active duty, you've got to enroll in the Part B with no break-in coverage, essentially. And then the last group of people is there are people who maybe don't have TRICARE, but they use the vet facilities for their care. And it's common for those people to come and maybe purchase an Advantage plan because it allows them to go to other providers other than just the VA places. So the point on this one is that the VA facility is not deemed to be creditable for purposes of Part B, and you will get a penalty. The other requirement that you have to meet if you delay Medicare Part A and B is you have to prove that you have creditable Part D coverage. And in order to delay. So I'm 66 years old, I'm on group health insurance for my employer. Well, how do I know if I have creditable health insurance, credible Part D insurance? Basically what creditable Part D means is that the medication benefit under my employer plan is as good as or better than Medicare. The only way that you know whether you have it is to go to your HR folks, your plan administrator, tell them, hey, I'm talking to a Medicare broker. I want the notice, it's called the Notice of Creditable Part D Coverage. And that's an important piece of paper to grab from your employer because later when you do retire at 68 and you go to enroll in Medicare A and B, the federal government is going to say, oh, well, I see Bethany, you're 68. Why didn't you enroll in the Part D? And you can pull out that piece of paper and show them that, and then you don't get the penalty. So that's an important piece to get from your HR department and just throw it in a file, essentially. So this next slide, I'm not going to spend much time. This is just coordination of benefits. It shows who paid first. The first column shows somebody has Medicare and group health insurance. There is a small employer rule. If you work for, and I don't think I covered this, and I should have earlier, if you work for an employer that has 20 or less employees and you want to delay Medicare, that employer is going to make you go on Medicare A and B. And it's a way of basically sharing costs for, I'm sure it was a piece of legislation that was passed to help defray costs for small employers. So under this scenario, you're going to have Medicare and you're going to have your group health insurance because you work for a small employer. Group health pays first, Medicare pays second. The second one is working, post 65, you have Medicare, you have, I'm sorry, I flipped that. 20 or more employees is the first column. Group health insurance pays first, Medicare pays second. Second column is the small employer, Medicare pays first, group health insurance pays second. Medicare, Medicaid. So somebody that has both, the first payer is going to be Medicare, the second payer is going to be Medicaid. And this last column is Medicare and retiree group coverage. I see this a lot with teachers. Some teachers, depending upon their age, tend to have these post-retiree benefits. Under this scenario, if they stay on the retiree health insurance through the school district, Medicare pays first, the retiree plan pays second. We talked about the annual enrollment period. That's the enrollment period that allows you to change your Medicare Advantage, your Medicare Part D plan. Your open enrollment period runs from January 1st through March 31st. This is not an advertised enrollment period. Brokers are not allowed to promote it or advertise it. It's important as a consumer to understand it because if you are on a Medicare Advantage plan, you are allowed during that time frame to switch to another Medicare Advantage plan. You won't see commercials about it, and it's not something that's promoted, but you have a legal right to it. The special enrollment period is that 8-month period that you qualify for if you work beyond age 65. So this shows the late enrollment penalties. The federal government takes this really, really seriously. So the Part A late enrollment penalty is a monthly premium. Your monthly premium goes up by 10% for each month in which you should have enrolled and you didn't. The late enrollment penalty for Part B is also 10% for each 12-month period. And the Part D late enrollment penalty is it's a multiplier. You take the national average of a Part D plan, which don't quote me, it's about $36 in 2024. You take 1% of that times the number of full uncovered months that you didn't have Part D, that you should have had Part D, and that's your monthly premium. My best friend from high school has an 85-year-old mom who 20 years ago, when she qualified in 2005, there was no Part D. And so she didn't sign up for Part D because there was no Part D. She's never been on any medications. She's on a supplement plan. She wanted to move to an Advantage plan. So I worked with her and found out that she had never signed up for a Part D plan. She pays $50 a month now for not signing up. So the system is just, it's crazy. Some of these penalties, and it's hard to hear sometimes. The easiest way of applying for Medicare is online at the first link. You can also go to a local Social Security office, call the 1-800 number, beware, you'll be on hold for at least an hour. The easiest way is that first link. It takes about 20 minutes. You need a Social Security account. So you need your username and password for a Social Security account, and that's how you apply for your Medicare A and B. Health savings accounts, there are some special rules about HSAs. So you are not allowed to contribute to a health savings account once you're on Medicare A or Medicare B. So best practice is 6 months before you enroll in Medicare, you really should stop contributing to an HSA plan in order to avoid any type of penalties. However, once you jump onto Medicare, if you have HSA monies in an account, you can use those. Those are eligible expenses for purposes of paying your Medicare charges. HSA eligible expenses include Medicare deductibles, premiums, co-payments, and co-insurance. Medicare supplement plan premiums are not HSA eligible. This is kind of again, a rule that I don't understand. So your Medigap premium, you cannot use your HSA monies for that. And this is all tax driven, federally tax accountant driven. So last page. So I'm focused on the needs and service to others. I really put a lot of emphasis on the education. It's so important that people understand the rules, and in order to make very informed choices. I'm very unbiased and consultative in my approach to the plans. I don't steer people in any type of direction. I look at working with people as partnering with them for life. It isn't just a one and done decision. And I'm appointed with all the major and local Medicare carriers. I'm the recipient of the state sales award the last 2 years in 2022 and 2023. So a little about me. So questions?
There was one question from the Zoom people. For supplemental, are you subject to underwriting yearly or only when you change your supplemental plan?
Only when you change it. So you pay your premium every year, and there is nothing you do at the end of the year. You just keep paying your premium and you have the same benefits. So I always tell people the only way that a supplement company can disenroll you is for failure to make timely payment. So I always recommend to people pay by bank withdrawal that's automatic. That way, if you take a fall or postal service is late or whatever, because if you miss a payment and it's late, then they can drop you and then you would have to go through medical underwriting.
Medicaid different than Medicare?
So I will start by saying Medicaid being a governmental program, it is not my area of expertise at all. I have no education in it. So people that end up being eligible for Medicaid, they will often end up calling me when they're eligible for the Medicaid and the Medicare. I know that every county has a center called the Aging and Resource Disability Center. They would be good people to talk to about Medicaid. Medicaid is going to have a number. I think there's also ombudsmen that also are representatives in the Medicaid system. And again,
They're completely separate.
they are completely, not at all involved in Medicare. Yeah.
Some Medicare Advantage plans that will have any except Social Security being part of their network.
I don't understand the question.
Well, network, if you have an Advantage plan, right?
Right.
Are there some Advantage plans that will recognize any doctor who accepts Social Security or Medicare payments as being part of their network?
The doctor has to be, I'm sorry, I'm still not understanding exactly the question. The doctor for your Advantage plan has to be contracted specifically for that plan. And it's not unusual. One of the things that I see, the PPO plan, so HMO versus PPO, HMO tends to be gatekeeper driven. You have to go to your primary care physician first, and then you have to get a referral, kind of like the insurance carriers did years ago. The PPO plans tend to have more fast benefits, and they will often have two groups of providers. They might have, I call them silver and gold. It's not what they're called, but it's an easier way of explaining it. They'll have a gold level group of doctors who are contracted and a silver level group. If you go to the gold level group, they want you going to the gold level group because your copays, deductibles, and coinsurance are going to be lower with them, and your maximum out of pocket is going to be lower. I'm not sure if that answers your question. I can talk separately to you on the side.
How many providers in the state of Wisconsin approximately do not accept Medicare patients?
I have no idea. I don't think I've ever been asked that question. I have no idea what percentage of I mean, I know that there are providers that don't accept. Obviously their fee structure is less. But I have no idea how the numbers shake out.
So then my follow-up question is, if you have an emergency situation, not within Advantage Plan, but with doctors in general, its responsibility is to determine that the provider that's giving you service accepts Medicare payment. In a scenario like you're in a hospital and your surgeon accepts Medicare, but you as a patient have no way to know if your anesthesiologist is accepting Medicare or not. And if he's not, you're on the hook for his full cost. So where does that respond? Is it the responsibility of the service provider to let you know, yes, I'll work on you, but understand I don't accept Medicare? Or is it the patient and their advocate to do that digging?
I don't know, but I can get back to you. It's an excellent question. Yeah, I don't know. No. Yeah, if you give me your name at the end, I can look at it and call you.
Thank you.
On your previous phase,
Mhm.
I will be 65 next October. So based on contributing to the HSA 6 months prior to me applying, I will need to apply and apply, correct?
Your birthday's in October.
Right, so I need to apply 3 months before,
Uh-huh.
which is July.
Mhm.
There shouldn't be contributing to my HSA anymore from January, or February.
Yes, yeah. So from a practice standpoint, it's, you know, likely if they were to turn it off in June, likely you're gonna be okay, but from a practice standpoint, this is kind of what the CPAs recommend, that sort of thing. So,
Typically, my employer makes 2 dumps into my
Mhm.
HSA, but
mhm,
it doesn't come at the first year. The first year would come in April, maybe.
sure,
The second, a couple months later, so
Yeah.
I basically get nothing. HSA.
yeah,
So,
yeah, unfortunately, yeah.
In the HSA that you've already accumulated,
Mhm.
you are able to draw from that. without
Yes, absolutely, absolutely. And those rules for, can I just go back a couple of screen? Oh, I'm sorry.
Yeah, hold on one second. I lost my connection
So
on my
the
computer.
rules on the HSA monies that you have accumulated, what can you use those HSA monies for, were defined on that one slide. And the one kind of catch is you
This one?
can't, yes, you can't use your supplement plan premium to pay your HSA, from your HSA monies. Why? You can for your Advantage Plan deductibles and premiums and co-payments, but
Not your premium.
yeah, not your premium. No.
And then I have another question regarding who pays first on one of your previous slides to
Mhm.
that too. I'm in a law office where a lot of our personal injury clients are on Medicare, and some of them have run into a situation where Medicare will tell the attorney that their automobile med has to pay first. Ever encountered that where the first payer is an automobile med pay?
No, never heard of that.
Yeah.
Small employer, right? Small law firm with less than 20 employees, and they're making people elect A and B. And then
No,
those.
no, this has nothing to do with my law firm. We're finding some clients come in that are on Medicare, and their Medicare will deny paying them, saying you have a medical payment coverage rider on your automobile insurance. And Medicare says you have to use that as the first payer.
So is that in a sense subrogation? Is that kind of what they're
Actually, that's
doing?
what it is, but
Yeah.
in your automobile policy, your medical payment coverage, be it 10,000 or 1,000 or whatever you
Yeah.
opt to get,
Yeah.
is yours to pay for your out-of-pocket things.
Yeah.
But there's something with Medicare that says you have to utilize that
Mhm.
as the first payer.
Mhm. So again, great question. I don't know the answer, but I can call one of my broker managers at one of the insurance carriers and perhaps she can answer that. Want to leave your name at the end and your phone number?
I want to take a couple of the questions from the Zoom crowd. And I don't know about any of you people, but I have a mental block on certain things.
Mhm.
Is this sign greater than or less than?
You're asking me.
I'm
with
asking
my
you.
57-year-old eyes.
So
wearing
if
my
it goes,
glasses.
so if the arrow goes this way to the number, is that greater than or is that less than?
This is greater than.
Okay, I just a mental block.
Yeah, but I don't have
Um,
my glasses.
So it says, please confirm that if still covered by a group plan with greater than 20 employees, you do not need to sign up for parts A, B, and D until you are no longer covered by group.
Yes,
That is correct.
yes, absolutely.
Okay.
However,
There's a however.
I would recommend if you, I would recommend that you apply for Medicare Part A. As long as you don't have an HSA account, apply for Medicare Part A. Part A isn't going to cost you anything. It's zero premium. The reason that I recommend that is because you get a Medicare card. You'll get a physical Medicare card with your Part A date on it. And it makes the whole process, when you do go to retire and go to a broker, all you have to do at that point is get Part B. And the reason I see this come up a lot, because people will come to me, I've had this happen a couple of times, and it's a difficult situation for me because it really isn't, it's the federal government, but I'll have people come to me, maybe they come to me in May and they say, I'm retiring August 1st. And then I guide them, tell them to get their Medicare A and B, depending upon how backlogged the federal government is. They might not get their Medicare Part A and B card until August 1st, and their retirement starts July 1st. And meaning I can't enroll them in a plan. So by adding the Part A now, then you have your card and you're like 5 steps ahead of everybody else, and you're pretty much set to go when you retire. Because then all you have to do is apply for Part B, which is a much quicker process than the Part A. But you don't want to apply for Part A if you're contributing to an HSA, because as I mentioned before, it's illegal. You will be dinged. There are other questions?
Yeah, there is one, and I'm trying to get my cursor over here to get it. When do you recommend a supplemental plan versus an advantage plan? It's probably what.
Well, it's based on a needs analysis. So I sit down with people. I'll send an intake form, which is basically a HIPAA protected encrypted form. I collect your medication information. I collect your doctor's names. I'll get your zip code. We'll sit down. We'll talk about the 2 different types of products. Oftentimes, some of this is based on lifestyle. Some of it's based on, do you want to deal with networks? The Advantage plans, if you're a snowbird, there's a special rule with the Advantage plan. If you spend 5 months out of the state of Wisconsin with an Advantage plan, you are required to drop your Advantage plan and pick it up wherever you're living, somewhere else. And then when you come back to Wisconsin, so things like that. So after I kind of explain all the rules, people usually are, something sticks on both ends, either because based on somebody's medical condition, they need to get up to Mayo in Rochester, Minnesota, because they have a rare condition, and the Advantage plans don't contract with Mayo in Rochester, Minnesota. So that alone is going to probably drive you to a supplement plan. So I guess I'd answer that by just saying it's all based, it's a needs process that is kind of vetted out when I sit down and talk to people.
This goes back to the last thing we were discussing regarding HSAs. If you have an HSA, do I still apply for Part A? Well, no, because you have to drop the HSA, right?
That's right.
Yeah.
Yeah, that's a no.
Okay.
How much can you donate into your HSA? Let's say if I'm 65 in September, how much could I put in for that calendar year? Because I dropped it at a certain point, and I'm self-employed.
Right.
Can you not put anything?
Yeah, I don't know the HSA numbers off the top of my head. I think there's $1,000 catch-up rule if you're over age 50. I think for a family HSA contribution in 2024 is 8,000 and some change. And then an additional 1,000 you'd qualify for, 9,000. That would be family. You'd have to be covering, I think, dependents. I don't know if it's just spouse. Really, all that type of a question is really a CPA question. I will typically say, really go back to a CPA to get the ins and outs, because I do not want to give incorrect information there.
So it's not as simple as just dividing it by 12 and saying, okay, this is what it would be on a monthly basis, so January, February. Divided by 12.
Yeah, I don't know. Yeah. All legally driven by the tax code and not my area. Mm-hmm. Mm-hmm.
Your first
Share into which.
So if the deductible is $2,000 thing, and you don't join, or you don't become eligible or 65 until you're October, so
Yeah.
October, you have to pay the full.
You're asking specifically for the Medicare Advantage plans because there are no deductibles for the supplement.
Yeah.
So, and I'm not sure if I really made this point, but what I tend to explain with the supplements, your cost with the supplement, as long as you add all those riders, it's pretty much your premium cost. For the most part, you can leave your checkbook at home. Can there be some incidental things? There can. If you have, I had a client recently that gets injections in her knee. When she was on Medicare, she started getting billed for it. They were stem cell. So Medicare doesn't, it's considered to be experimental. So Medicare doesn't cover it. In order for the Medicare supplement plan to cover the charge, it's got to be Medicare approved charge under Medicare Part A and Part B. But under the Advantage plans, yes, you pay the full deductible regardless of when you come in during the year. Question? Lots of good questions.
Very good.
Yep. Okay.
Okay.
So my cards are here. Medicare has some rules. I often have advisors here, other advisors or friends that are like, so-and-so wants to talk to you. They need help. I cannot reach out to anybody. It's illegal for me to do. I can get my health license taken away. There are business reply cards up here. If you want me to contact you, you could sign it and grab my card, but it's just one of many rules regarding agents. So
People left on Zoom, thank you for joining us. I will be sending out the presentation to your emails probably in the next couple of days. So you will get that. So if you have any questions beyond that, I'll refer you to Bethany. Okay. All right. Thank you all very much. Have a wonderful evening.
Thank you.